Hello and welcome to another episode of Health in Focus with Dr. Laura. Today I'm continuing the series on Am I Healthy? And this is part 2 of 2 series talking about health. Now in part 1 I talked about what the definition of health was, and I'm just going to quote that to you again. Health is a state of complete physical, mental and social well-being and not merely the absence of disease. So when you talk about health, we're talking about different parameters that will decide for you whether you are healthy. A few of the things that I mentioned in the last program were to ask yourself, do you get enough exercise? Because exercise guarantees good health. Diet, do you have a good diet? Do you sleep for at least 8 hours? Have you stopped smoking and drinking excessive alcohol? Do you have stress release habits? Do you take in a lot of fluids? Do you eliminate waste regularly? And do you socially interact? So exercise, diet, sleep, habits which are healthy, such as not smoking and not drinking a lot, as well as eating natural things, are very important for health. So we'll talk about the first 4 benefits. Exercise, first of all. Exercise is beneficial. Studies in well-known clinics like the Mayo Clinic and King's College in the UK have shown that exercise increases the blood supply to all the organs, the heart, the brain, the lungs, and all the tissues. Memory is improved when people exercise. The cardiovascular system, that's the heart, the function of the heart, is improved with exercise. Exercise also helps with the immune system. Exercise makes your bones stronger. It causes you to gain muscle mass. Muscle mass needs more mitochondria, which is the energy-producing cells, the energy-producing mechanisms in the cells. So the more muscle you have, the more energy, the more calorie you burn. The stronger you are, the fitter you are, your posture's great, you sleep well, your mood improves, because exercise gives you lots of positive neurohormones such as dopamine and the endorphins as well. So exercise is beneficial on many levels for bones, for mood, for general longevity, etc. So exercise is beneficial. The next thing is diet. And I love how God started out right in the book of Genesis with the Genesis 1:29 and then the Genesis 9:3 diet. And what does Genesis 1:29 says? It says, God says in Genesis 1:29, I give you every seed-bearing plant on the face of the whole earth and every tree that has fruit with seed in it. They will be yours for food. Now, of course, after the flood, after sin and after the flood, God added in Genesis 9:3, and every living thing that lives and moves will be food for you, just as I gave you the green plants and now give you everything. Now, God has given us a blueprint to having a rich and healthy diet. In the past program, I talked about the G-bombs. Now, all the foods that God has advised us to eat in Genesis 1:29, you will find in the G-bombs, and G stands for greens. So you've got your kales and your spinaches and rocket. All those leafy greens are rich in lutein, zeaxanthin, glucosamides, glucosinolates as well, and they help to keep you healthy. They're high in fiber. They're high in isothiocyanates, which are compounds that are particularly good for fighting cancer. So G for greens, B for beans. Beans are high in protein, they're high in fiber. They keep the body, the bowels regular. They cause a lot of probiotic bacteria to have enough nutrients of their own to work, and they help to prevent colon cancer. So G-bombs, the O stands for onions, the alliums. The alliums are good for bacterial and viral prevention. They're also good to boost the cardiovascular and the immune system. And one of my favorite drinks when I feel myself coming down a little bit of sniffle or sore throat, and I actually advise my patients as well, to make a nice infusion of garlic, ginger, honey, and lemon, and have that 3 times a day. And I tell you, there are no bacteria or viruses on this earth that won't flee from your body with that kind of remedy. So onions and all the allium vegetables like onions and garlics are very good for cardiovascular health, as well as for the immune system. Also found to be good for diabetes and also in prevention of cancer. So M stands for mushrooms. Mushrooms help to decrease, are shown to decrease the risk of breast, colon, stomach cancers. Mushrooms are also high in vitamin D, the sunlight vitamin, which is important, and they're also high in beta-glucans, which help in boosting the immune system in their fight against and prevention against cancer. B again, the other B, so we got the B for beans, and now we've got the B for berries, and the berries are the purples, the strawberries, the blueberries particularly, the blackberries and all those berries. They have a cardioprotective and also an anti-cancer function. They help to reduce blood pressure, they reduce inflammation, they prevent DNA damage, inhibit tumor angiogenesis. This is the formation of blood supply that helps to make cancer cells grow. They also help in the reduction of risk of diabetes, cancer, and also blueberries are good for memory. So they help in slowing down cognitive decline and therefore have a role in prevention of Alzheimer's. S, so we've got G-bombs, and S stands for seeds. Seeds are nuts, and of course those are rich in omega-3, and they're very useful for the brain as well as the heart. So the benefits of diet, Genesis 1:29, and of course God added in animal protein because we do need protein for all the function, all the hormones and all the enzymes are all made of protein. So we need protein for muscle, our heart, and all the muscles are made of protein. So God has given us protein in the form of animal protein. There is obviously, there are vegans who don't have any animal meat, but I really believe, and I've seen enough research to suggest that the better balance is not a completely vegan diet, but a mainly plant-based diet with a little bit of animal protein. Why do we need sleep? We need at least 8 hours of sleep. The best average of sleep recommended is between 8 and 9 hours, no more, no less. Again, we need sleep because we need our brains to develop properly. We need to have to be able to regenerate our cells. There needs a lot of repair that goes on when we're asleep. Lack of sleep causes a patient to have a predisposition to heart disease, to poor immune system. People who don't have enough sleep are 3 times more likely to come down with a cold in the winter. So sleep is very important. Sleep is also important for metabolism. People who have a broken sleep tend to gain weight because there is a production of more of leptin, which is the hormone that causes you to increase your appetite, and not so much of ghrelin, which is the hormone that suppresses your appetite. And it also, poor sleep also causes insulin, a high insulin resistance, therefore a patient is prone to obesity and to type 2 diabetes. During sleep, growth hormone is produced, androgens are produced to help to repair and build up tissues. And also, sleep helps to improve your mood. As most mothers with young babies will know, sleep deprivation can make you a very ratty mother, and in some sentences, sleep deprivation is used as a form of torture in prisons. Good sleep improves your mood, stops you feeling depressed, and it also means that you're not producing a lot of cortisol, which is a stress hormone. What are the benefits of stress reduction? Prayer, the benefits of resting, the benefits of forgiving. All these things will help to keep you healthy. Now, so we've summarized what I discussed in the first half of Am I Healthy? And I'm going to go to the second part, which is questions to ask yourself. Do you know your vital statistics? If you want to be healthy, there are certain things that you need to know about yourself. And so I'd like to go for the first interview on the street when I asked the viewers and passerbys whether they knew their vital statistics. Do you know any of your vital statistics, like blood pressure and that sort of thing?
Yes, I do. I'm a nursing professional myself, so I feel that is extremely important. One can't just live thinking that you are feeling well and therefore everything is okay. Hypertension is a disease that has no particular symptoms. and therefore it's very important to have your blood pressure checked at least yearly, I would say. I think you need to know whether you are diabetic or not, what your glucose measurement is, and also to make sure that you have a healthy weight range, I'd say. Other things that's important would be cholesterol monitoring. I think one has to be in tune with what is good for you in terms of food, healthy fats, and so on.
I know a few of them. I know about blood pressure that gets higher when you do exercise and stays lower when you're inactive. Also, I know about gut biome, cholesterol level, and other things like this.
Fantastic. And how come you know so much?
I like to listen in my free time to podcasts and shows on internet about vitality and life longevity and these things, and a lot of people are interested and are speaking all the time about this.
Blood pressure, weight, height, metabolic age, so quite a lot.
Yes, I do. Well, I'm pretty aware of them all. I'm very aware of my weight, my sizes, and my blood pressure.
Excellent. Welcome back to Health in Focus with Dr. Laura. So I just went out on the streets and asked these passers-by what they felt and whether they knew what their vital statistics are. And I can tell you from the point of view of a doctor, it's so important that people know what the basic vital statistics are. So your pulse and your blood pressure. Hypertension is not a disease that people can detect easily. It's a silent disease, and sometimes people don't know they've got high blood pressure until they start to get symptoms which could be irreversible. So it's important to know what your pulse is, your pulse and your blood pressure, because if you've got a fast pulse, it might indicate that there's something going on with your heart, something like a conductive problem. An irregular heartbeat could be picked up, something called atrial fibrillation, and that itself can cause problems with the flow of the blood and can predispose a person to blood clots. So it's important to know what your pulse is and whether it's a regular pulse. A healthy pulse is really anything between 50 and 70. Anything above that, you might need to exercise a little bit more to bring your pulse down. But if you've got consistently a pulse of 80, 90, 100, that should ring warning bells to you to say, head to your GP to get it checked out. And how would you know if you don't check your pulse? So make an appointment. I say make an appointment with your doctor and have an MOT once a year. That's my mantra. And I tell all my patients over the age of 40, see you next year for your MOT. And they say, what do I need to have done? And I tell them blood pressure, weight, etc. Also important to know about your weight, because type 2 diabetes, a lot of people who are overweight have a predisposition or are just about to start to develop type 2 diabetes. So it's very important to keep your weight in the normal healthy range, which is between 20 and 25 body mass index. So again, it's important to know your weight. I know sometimes we don't like to weigh ourselves, and some patients will come in and say, I don't want to know my weight, you just record it. And I say, that's fine, I'll record it. You can shut your eyes when you get on the scales, but I'm going to record your weight. I'm going to tell you whether you need to lose weight or not. You don't have to know about it, but it is good to know what your weight is, because knowledge gives you better information to be able to nip things in the bud. Waist circumference, again, an important indication of whether you can become diabetic. So men with a waist circumference above 40, not good. Women with a waist circumference above 35, there's inches, also not good. Have you ever had a blood sugar checked, a fasting blood sugar? There are people who for years and years don't even know what their blood sugar is. Again, I would encourage you, if you're over the age of 40, go in every couple of 2-3 years and get your bloods checked. If you're over the age of 60, I would suggest you have a yearly MOT. Cholesterol is another one that people are not aware whether the cholesterol is high, low, or normal. High cholesterol, again, could be a risk factor for heart cardiovascular disease. It could be an indication that the coronary arteries may be getting blocked. And if you don't know what your cholesterol level is, then you don't know whether you need to alter your diet or your lifestyle, such as exercise and a low-fat diet, to incorporate foods and a lifestyle that will lower your cholesterol. So, when did you last go and see your doctor? Have you been to see, if you're over the age of 40, have you been to see your doctor in the last 3 years? If not, please, Dr. Laura would like to encourage you to go and see your doctor. If you're over the age of 60 and you've not been to see a doctor in 12 months, again, Dr. Laura would encourage you to go and see your doctor. So I went in the streets again and I asked these people out there, when was the last time you went to see a doctor? And this is what they had to say.
A year ago.
I'm very lucky with my health. I very rarely go to the doctor. Probably haven't been to the doctor for 20, 25 years.
So we had two age extremes there. We had a young man in his 30s and a woman in her 60s, thereabouts. And one of them said he'd been to the younger one said he'd been to see the doctor a year ago, whereas the lady who was, obviously over the age of 50, hadn't been to see the doctor in a long time. I would say to you, listen, if you're over the age of 60, please go and pay your doctor a visit and have an MOT. Get your blood pressure, your waist circumference, your cholesterol, your blood sugar, and all those things checked. You need to have an MOT. If you're over the age of 40, try to see the doctor every 2 to 3 years. But again, as I said, if you're over the age of 60, try to see your doctor at least once a year. And why do you need to see your doctor? The NHS actually provides lots of MOT health checks. How many of you have had, over the age of 49, 48 women, have you had a mammogram? Some of you may not want to have a mammogram because you don't particularly have a family history of breast cancer. And if you are worried about the radiation from a mammogram, there's something called a thermogram. Now, thermogram actually does not use X-rays. You can't get it on the NHS, but if you're worried about your breasts and you would like to have a non-X-ray type a scan of your breasts, then go and have a thermogram. I have to be honest with you, and I've had both a mammogram and a thermogram. And I would like to say to you that if you're worried about radiation with mammograms, because they use X-ray radiations and it's a very unpleasant procedure, go and have a thermogram. And you will find information about where you can get a thermogram. If you just Google the Natural Doctor, the Natural Doctors is a clinic in Harley Street, and they provide thermograms there, and I have actually been there. You may not be able to afford the prices, but I would encourage you that if you are concerned, please go and see your GP and get yourself checked. And women, you should be checking your breasts anyway regularly. So breast checks, blood tests, cervical smears. Have you had a smear? Young ladies, the NHS provides a screening process for women between the ages of 25 and 64. The good news is when you get to a certain age, you don't have to have them every 3 years. When you're younger, between the ages of 25 to about 50, I believe it's just under 50, or just over 50, you have to have the cervical screen every 3 years. But when you're over 50, it's only every 5 years. So how about that? But you do need to keep having those smears. So please, cervical cancer, we know of people who have died of cervical cancer when they've been very young, and this could have been picked up and acted on much sooner. So please avail yourself of the cervical screening process and go and have your cervical screening. And people over the age of 55, guess what? The NHS is now providing over 55s with a sigmoidoscopy. And again, this is a drive to try and detect early changes in the bowel, particularly in the latter half of the bowel, in the sigmoid colon, where they can find things like polyps and diverticulae. And so if you're over 55, you should have got a letter to say, go into hospital to have your sigmoidoscopy. I would encourage you to do that. If you're over the age of 60, then you'll have your NHS bowel cancer screen, which will be a little discreet little envelope in the post for you to produce a sample and to send back. Please, please, please have these tests done. So get your MOT blood test. And what should you have in an MOT blood test? Every 3 years for the 40-year-olds and every year for the 60-year-olds. You need to have your cholesterol, and there's a fasting blood test for cholesterol, blood sugar, hemoglobin and white cell count, vitamin D, vitamin B12 levels, your kidney function, your liver function, your thyroid function, your inflammatory markers, something called CRP. And for the men, make sure that you have your prostate enzymes checked as well. So now we're going to go to a couple of other clips where I've been on the streets asking these lovely people who pass by the mic what their benefits for having the MOTs and whether they would actually recommend these health checks.
Yes, I wouldn't say regularly, but I went a couple of years ago and had a private screening done. So I had quite a full suite of measurements taken.
So I've just had a checkup at the doctor.
About my personal numbers, I'm not so well informed because I don't go to the doctor so often.
How often would you like to do this sort of health check?
Yeah, I probably would go every 2 to 3 years, just to check that everything's still okay. Don't want to take my health for granted, but obviously getting older, and so it seems worth checking up and doing what I can to keep healthy.
I've had a routine examination from the nurse.
I think I should start in the next 5 years. Well, I know it should be done right now, but I have other priorities at this moment.
Welcome back. Yes, so there's the views of that there. And I'd just like to repeat this. If you're over 60, get your MOT every year. If you're over 40, every 2 to 3 years is adequate. So in addition to the smears and the thermograms or mammograms, in addition to the over 55 sigmoid endoscopies and the over 60s NHS bowel screen, what other MOT checks are worth and recommended doing? Hearing tests for those who have problems with hearing. Make sure there's no wax in your ears, first of all. And I would also recommend an eye test as well. Get your eyes checked regularly. There are lots of eye diseases like glaucoma, retinal problems, macular degeneration that can be detected by going to see your optician or optometrist once a year. And I really would encourage you, and if you're over the age of 40, again, once or twice, once a year or every couple of years. And if you're over 60, try and make it regularly, at least yearly, so that if your pressures are increased, if there's a macular or retinal problem, then these can be picked up early. It's all about early detection, all about early detection. Another important thing for people to do is please go and see your dentist. Why do we need to see the dentist? Because a lot of oral gum disease can affect a person's health. If a person has chronic gum disease, it can cause to not just the bone loss, because the bone that supports and holds the teeth together, but it can actually cause chronic inflammation in the body, as well as cardiovascular problems. For instance, if somebody's got rheumatic fever, if they were going to see the dentist for a dental extraction, they would need to take some antibiotics, because the bacteria that could be released into the blood system can affect the heart valves, especially if they've had a problem in that area already. And it just goes to show that the bacteria that cause plaque around the teeth and the gums, that cause erosion of the gums, that cause gingivitis, that cause decay in the tooth enamel, can be dangerous. So apart from going to see your dentist every year, and again, I would recommend a yearly check, at least to see your dental hygienist, to have a good old clean, top to toe clean. Also, brush your teeth, floss, and use an interdental brush every day, twice a day. So brush, floss, and use an interdent brush between your teeth to get into those spaces at least twice a day. So these are some more tips on MOTs that are worth doing. And you know, if you do these things, you will detect things. If there are any things to detect, I mean, we know as Christians that one of the benefits of being a child of Christ is that God does say that, you know, he heals all our diseases, he forgives our sins and heals our diseases. But we do know that we live in a fallen world. So there are times when diseases come our way, even if we've done absolutely nothing. But what is important to do is to make sure that we are not sitting on a time bomb that's about to go off just because of lack of prevention. So go and get those checks done. Healthy habits. Now, this is one of my favorites. Supplements and hand washing. Now, we all know, and you know, you can get blueberries at any time of the year because they're shipped in from other countries. We know that we don't always have an adequate diet. I'm guilty of that as well. Sometimes I'm rushed and trying to get to do this, that, and the other, and I forgot to shop and you know, run out of my blueberries, which are my go-to fruit, and my all the other sort of fruit that I have. And, you know, I believe that you should take supplements. I do. I'm not trying to force it on you, but I think that The way our plants are grown, the way the soil is not allowed to regenerate minerals before more crops are grown, I don't think the soil has enough time to regenerate. And a lot of the time, our foods are shipped from far off countries, so they're actually harvested way before they're ripe and mature in order for them not to go off. And so we're not really getting as many nutrients as, say, our grandmothers had. And so I would encourage you to take supplements, and the sort of supplements that you need to think about taking. Now, this is not a hard and fast rule, but I'd encourage you to take things like turmeric and black pepper because they're good for inflammation. They help with joints as well. So, turmeric is a go-to. I would suggest you take things like coenzyme Q10, vitamin C, zinc, selenium, vitamin D, particularly if you live in the Northern Hemisphere like we do. We don't get a lot of sun, so most of us are vitamin D deficient if we don't take vitamin D. So do take your vitamin D, omega-3 as well, fish oils. Milk thistle, fantastic. Probiotics like kefir or the lactobacilli and bifidobacter probiotics, very good for gut health, are so important. If you have joint problems, if you've overused your joints because you've been an athlete, you might need to have something like MSM, collagen, glucosamine, chondroitin, cherry to help to prevent further degeneration of your joints. Hand washing is very important. I can't overemphasize how important it is for you to wash your hands after going to the toilet, before eating, because 95% of germs are spread by hand contact. And so it's important to wash your hands so that you can protect yourself and protect others from picking up bugs. Sweeteners is an important thing to consider because there are lots of natural sweeteners. If we don't want to have things like sugar, which are just sweet without any nutrient benefit and actually can be pro-inflammatory. We have alternative sweeteners like date syrup, stevia, maple syrup, coconut sugar, xylitol, and honey. Honey is last on the list because it's very difficult to get proper honey. But other possible alternatives to sugar are the ones I've mentioned: dates, stevia, maple syrup, coconut, and xylitol. You've been watching Health in Focus with Dr. Laura, and I just want to summarize. If you are over 40, go and see your doctor every 2 to 3 years and get an MOT, vital statistics. If you're over 60, see your GP every year to check all those things. And don't forget, exercise, diet, sleeping well, stop smoking, having a very minimum amount of alcohol, relieving stress through prayer and the Word of God, worship. Make sure your bowels are empty, make sure your bladder is empty regularly, and also social interaction are very important to keep you healthy, spirit, body, and soul. You've been watching Health in Focus. Do interact with me on laura@revelationtv.com. I'd be grateful to hear from you and let me know what topics you want me to cover, and stay tuned for another program in the near future. God bless you.